Hi, I'm Claire Miller from the University of Amsterdam.
I'm Sara Bridio from Politecnico di Milano.
And I'm Nerea from Amsterdam University Medical Centers.
So today, Sara, Nerea and myself are going to be talking about in silico clinical trials for the treatment of acute ischemic stroke. So the idea of an in silico clinical trial is that we can predict the outcome for a set of or a population of virtual patients from particular treatments or therapies, and by doing this, we can help to reduce the cost, the duration, and the risk of a traditional clinical trial and try to provide some information as to what devices or treatments should be pushed through the clinical trial process and into actual practice. So the particular disease we're interested in the INSIST project is acute ischemic stroke. So what happens during acute ischemic stroke is that a clot will block one of the arteries supplying blood to the brain, and this will reduce the blood perfusion through the brain, and as a result of this, some of the brain tissue will begin to die. If this isn't treated fast enough, patients can end up with a high level of disability or even, in the worst case scenario, indeed die. So the idea behind the INSIST framework is that we could replicate a traditional clinical trial on the computer. So we do this by generating a cohort of what are called virtual patients. So these patients are not real patients that have appeared at the clinic. They're patients that we have generated that are similar to a patient that would appear at the clinic with a stroke. So once we have a patient and their set of characteristics, we can then attempt to predict the outcome of a treatment and the brain tissue injury on this patient if they were to have a stroke. Once we have the treatment outcome and the brain tissue injury, we can then estimate the level of disability that we would expect for that patient. Once we've done this for a couple of hundred patients, we can then look at the distribution of their outcomes, and we compare whether there's different treatments that result in better distributions or worse distributions, or if there are particular subpopulations that have responded better to the treatment or not. So we have set up this compute environment called DESIST, and the idea behind this is actually a general framework for anyone who's interested in running in silico clinical trials. So this could be for any particular disease where you just want to simulate or predict outcome based on a set of virtual patients. So the idea being that anyone who has these models to predict a patient outcome can download this onto their local machine and run their own kind of in silico clinical trials. For the stroke application, in terms of what we're actually modelling and predicting, we have to look at 3 different states for each patient. So obviously, in order to understand the damage to the brain, we also need to understand what the state of the brain was before the patient actually had the stroke. So this involves what the state of the blood flow was to the brain, and then the level of blood perfusing through the brain. Then we can place a clot within the system to simulate the stroke scenario, and this will obviously change the level of blood flow to different parts of the brain, and then the perfusion of that blood through the brain. We then model the treatment scenario, and there are 2 current treatments for stroke. So the first being thrombolysis, which is a drug treatment, and the second being thrombectomy, which is a surgical treatment. Once we know the outcome of this treatment for the patient, we can then again update what the blood flow and the perfusion is. And then, given all of this information and the timing between the stroke and the treatment, we can predict how much of the tissue we think will have died over that period of time and then over the subsequent 24 hours to determine exactly what we think the patient outcome will be in terms of their level of function. So today we're going to specifically look at in a bit more detail at the thrombectomy model, and Sara's going to give you a bit more information about that now.
Thrombectomy is a minimally invasive treatment for acute ischemic stroke. It is performed by the neurointerventionist that accesses the patient's circulation with a catheter and reaches the occlusion site, where a device called stent retriever is deployed. It entraps the occlusion, the thrombus, and hopefully they are successfully retrieved from the patient vasculature to restore the blood flow through the tissue, the brain tissues. So to include a thrombectomy model inside this in silico trial pipeline, we started by modeling all the elements that are involved in this procedure. So as you can see in this video, we have a in silico model of the patient vasculature, of the device, so the stent retriever, and also of the thrombus, the occlusion. With these 3 elements, We do these in silico, so computational simulations of the procedure, which is high fidelity, so resembling what actually happens to the patient in the clinics. This simulation was validated with in vitro experiments and also with clinical data. So after the validation, we were ready to build the database for our predictive model to be included in the in silico trial. So what we did was to collect hundreds of patient vasculatures and to create these computer models of these of the patients by placing also the occlusion in the vasculature and by simulating the procedure in each of these patients. So in the end, we had hundreds of these simulations. To each simulation, of course, is associated the outcome, so that can be successful, like the example on top, where we see that the thrombus is completely removed from the vessel and so the blood can flow through the vasculature, or the outcome can also be unsuccessful, meaning that the stent retriever loses the thrombus inside the patient vasculature and so the occlusion still holds. So when this was useful to create our database, over which we can then build our predictive model. But first, we perform an analysis of the anatomy of the vasculature of each patient, because you can see that the cerebral vessels have this very tortuous anatomy. And so we were trying to understand which of the anatomic parameter had an influence on the outcome of the procedure. And also not only the vessel, but also the characteristics of the occlusion. So the location, the length, and the composition of the thrombus. So after this analysis, we could identify a set of anatomic and occlusion parameters that have much influence on the outcome of the thrombectomy. So with all these analysis and our database with many virtual simulations of the procedure, we could build our predictive model. So when a new patient comes, we can analyze the images of the patient or of the virtual patient in the case of the in silico clinical trial. We can extract the important parameters that determine the outcome of the procedure. And then, so the predictive model can provide an estimate of the chances of success or failure of the thrombectomy procedure on the patient. So now Nerea will give us an example of the use of this model integrated in the in silico pipeline.
As a proof of concept, we ran an in silico trial where we compare the thrombectomy success rate for high fibrin and low fibrin clots. What we suspected is because these clots have different compositions, they will have different biomechanical properties, and therefore they will interact differently with the stent, and this will lead to different recanalization rates of the patient. What we saw is that patients with high fibrin clots had less recanalization success, so they have lower success rates, and this is what you can also see in the graph. And these results, of course, show that in silico trials can be used to test different clinical scenarios in real life, and we think we are in the right path, but of course we acknowledge that we need further work to relate these results with patient clinical data. To conclude, we would like to thank all INSIST investigators for all their work and all of you for your attention. So thank you.